Hey everybody, Dr. Paul Etchison here. Thanks for tuning in to this module, the role of the treatment coordinator. Okay, this is for you, treatment coordinators. This is for anyone at the front. This is for anyone in the back that may present treatment. This is going to help you have more patients say yes, and it's going to help you help more patients, because when patients say yes, they get healthy. So this is our goal. We want patients to say yes, and there's an art to it. There's a little bit of science, but most of it's an art. It's how do we talk about finances? How do we present them to the patient? And we're going to go through this in this series of videos. So thanks for tuning in. And I just know you're going to get a whole bunch out of this. So let's get into it. So before we get too deep into this, let's talk about what the role of the treatment coordinator is. And this is what most people think it is, all right? So we say, well, I guess we present the financial portion to the patient, right? Yeah, we show them what the insurance is going to cover, what is the copay. We're just showing them just what our prices are, what is the treatment that we're doing. And then we offer to set up the next appointment if the patient wants to book. So the way this usually looks for most people is they say, okay, this is what your insurance covers. This is what we're recommending doing. And this is what your out-of-pocket copay would be. All right, do you have any questions? The patient goes no, and they say, okay, good. Can I set up your next appointment? And the patient goes, I'm going to talk to my wife. I'm going to talk to my husband. I have to think about it. I have to look at my schedule. I'll call you back. And they say, great. Well, thanks so much for coming in. You have a fantastic day. And then most people that work on the front end would say, I did my job. I did a great job. But I'm going to show you something, and I'm going to tell you that it's a little bit more than that, because that is the bare minimum. And using that sort of presentation style, you're not going to convert many patients. You have these patients that they want to get it done, but we want to make it as easy as possible for people to get it done. So what is the real role of the treatment coordinator, okay? We want to be the patient's advocate. We want to help the patient get the treatment completed. Now, what does that mean? How do we help a patient to get it done? Now, a lot of people say, what am I supposed to do? I don't want to use trick words or car salesman tactics, things like that. That's not what I'm saying. But what I'm saying is that you should be the patient's helper. You're helping them get this stuff done, whether or not, they have to want it. They have to want to have it done, and that's done in the back end by the doctor and the hygienist and the assistant, the people that are presenting the treatment. But the thing is that we have to make it easy for the patients to say yes. So what does that involve? We're going to address any confusions. We're going to say, is there anything that you don't understand? Things like that. We want to see if there's something that the patient doesn't understand about the treatment. We want to be able to answer that question. We're going to address any objections. Now, the patient might have some objections. They might not think they need the treatment. It might be money. We always say, it's always money. Sometimes it's other things. Sometimes it's time. They just don't have the time to take off. It's things like that. Sometimes they don't think they need the treatment. Sometimes they don't really understand what the treatment that we're doing. So what we're trying to do is reduce barriers. We're reducing that transaction friction. We're making it easy. And a lot of times, we need to present the financial options to our patients. We don't wait for them to ask, okay? We offer it to them, because think about that. A lot of people need financing. Think about how you buy your car, how you buy your house, how you do any sort of large purchase, any sort of large monetary investment. It's usually patient. It's usually that you finance it. So we want to present these things, because a lot of times, sometimes the patient might say, you know what, this is a lot of money. I don't have it. But then you show them the payment and they're like, oh, I think I could make that work. So we want to be able to present that. And then the last thing is we want to follow up with patients that don't appoint right away. So if they don't appoint, we're going to go ahead and follow up with them and, just give them a little reminder. Maybe they got some more questions. Maybe they'll give us an objection at that point that we can address. But we want to make sure that we're following up with people, because you know how it is. I remember one time I went to the doctor. I had to get my cholesterol checked. It was a little high. And I said, you know what? I haven't been very healthy lately. Give me 2 months to get it in gear, and I'll come back and I'll take the test again and it'll be better. So I did that. I got it in gear. I went back and I took the test again, and it was better. But it was 14 months later, right? I just kind of forgot about it. our patients do the same thing. So in this module, we're going to go through a lot of things. We're talking about how to present it. We're going to talk about handling objections. We're talking about the pitfalls, the things that we do to kill the cases, how to finance, and some of the biggest mistakes that we make as treatment coordinators or people that are presenting treatment. So I thank you for watching this video. I hope it's really informative, and I know when you try these things on your patients, they're going to make a big difference. All right, we'll see you in the next video.